మీ ఫోన్లో లాగిన్ అవ్వు.
వీడియో ఆన్లైన్ ట్రైన్ సరే
చెప్పేటప్పుడు
Sir, is my voice audible? Suman sir?
audible, sir.
Sir, is my voice audible? Okay, okay. Okay, sir. Just to check. Suman sir, madam has joined.
Joined, sir.
Okay, sir. We'll start by 11 o'clock.
Okay, sir. Okay. So good morning to all the delegates who have joined for 5 days online FDP on innovative methods in analytical sciences, conducted by Sri Vasavi Institute of Pharmaceutical Sciences, Tadepalligudam. So it is a wonderful session going on from the last 3 days. So yesterday we have seen a wonderful session on artificial intelligence. So I welcome Dr. V. Bhaskar Raju Garu, so Principal, Sri Vasavi Institute of Pharmaceutical Sciences, and Dr. Kiranmayi Mandava, so Professor and Principal, St. Paul's College of Pharmacy, Hyderabad. So today she is a speaker for this session. So with these few words, I request our Principal, Dr. V. Bhaskar Raju Garu, to address the participants.
So thank you, Suman sir. And good morning to all the participants and our resource person for our fourth day of the faculty development program. So Dr. M. Kiranmayi madam for our topic regarding innovative methods in analytical sciences. And on behalf of our management, faculty and students, I welcome our resource person, Dr. Kiranmayi madam. So she is the professor and principal of St. Paul's College of Pharmacy, Hyderabad. And we are very delighted to hear from her a valuable and informative and innovative session, which is very useful to all our participants. So now I request our faculty, Pallavi madam, who is the assistant professor of Srivastava, our resource person, Dr. Kiranmayi madam, followed by the presentation of our research person. So Pallavi madam, please continue.
Sir, how are you? Sir? Good morning to Dr. B. Bhaskar Raju sir, Principal of Sri Vasavi Institute of Pharmaceutical Sciences, Tadepalligudam. Good morning to Professor Kiranmayi Mandava madam, working as a principal and professor in St. Paul's College of Pharmacy, Hyderabad. Good morning to all the delegates who registered for online FDP on innovative methods in analytical sciences. Myself, B. Pallavi, working as a assistant professor in pharmaceutical analysis. It is my privilege to introduce today's speaker, Professor Kiranmayi Mandava Madam. She has been working in the profession of pharmacy for about 20 years. She completed her B Pharmacy from Sri Padmavati Mahila Vishwavidyalaya, Tirupati in 1999, M Pharmacy from JSS College of Pharmacy, UT in 2007 with distinction and is a gold and silver medal recipient, received Doctor of Philosophy, PhD in Pharmaceutical Sciences from JNTU, Hyderabad, Telangana in 2015. She has a strong research background with 70 plus publications, one book, 4 book chapters, and 4 patents. She has been acting as peer reviewer for Scoopers Indexed International Journals, acted as a resource person at national and international scientific platforms, and presented papers at prestigious conferences. Her innovative approaches to curriculum development, teaching, learning methodology, research, and student engagement have earned her the administration of peers and colleagues. Presently, she has been working in St. Paul's College of Pharmacy as a professor and principal. As a staunch advocate for student success, she has relentlessly championed educational equity, diversity, and inclusion. Her tireless efforts to create inclusive learning environment has empowered students from all backgrounds to thrive academically and socially. Thank you, madam. I request you to deliver today's lecture.
Yeah, thank you, Pallavi ma'am. Thank you for your nice introduction. First of all, I would like to convey my thanks to Dr. Bhaskar Raju, Principal of Sri Vasavi Institute of Pharmaceutical Sciences, for giving me this opportunity. And hello, Bhaskar. Like, this is the, I think, first time on professional platform we both met after our M-Pharmacy. And other faculty of Sri Vasavi Institution and delegates who registered for this FDP to gain some knowledge and to update knowledge regarding analytical techniques. Welcome you all. And today I'm going to deliver a small topic. Like we cannot cover this particular topic within an hour. It's a very lengthy one. But I feel like this is the present trending topic, and if any FDP, if we deliver this, people will generate interest towards it and they can start learning about it. Like, I have chosen this topic. So if you make me as host, I can share my screen.
Okay, madam. Yeah, you can share.
Just a minute. Is it visible to you, sir?
No, ma'am, not yet.
Now?
Yes, ma'am, your screen is shared.
Okay.
But
Technical glitches are there little. It's slow. Connection is very slow. Zoom platform. Is it okay now?
no, ma'am, screen is shared, but the PowerPoint is not yet opened.
It's opened. I can see the PowerPoint now.
In the shared screen, it's not opened.
You are still it is sharing. The connection is very weak.
Yeah,
It is
yeah.
showing
Here it is
here.
showing the drive what you have
Me,
opened.
it is visible. You ask someone else, like participants, are they able to see this?
See, any participants are visible the PowerPoint?
PowerPoint is not visible, madam. Only the drive is open.
PowerPoint is not visible. Pardon?
PowerPoint is not visible, madam. So what you have, the drive you have opened, the downloads that is only showing.
Okay, downloads only showing. So the
Yes.
connection problem, I think Zoom platform, it is not, it's very slow, it is showing to me. But here I can open the screen. First slide I can see.
So if you can send in
Can I
WhatsApp.
share it again?
Yeah, ma'am.
Just a minute. Now?
Also, it is still rotating only. It is still in downloads only.
Okay, I'll do one thing. If you could able to, someone send mail to me or WhatsApp. Can I go for WhatsApp? It is showing to me actually.
Yeah, you can do one thing, ma'am. If you share to us, I can open from here.
Yeah, right.
సరే ఏం పంపించలేదా మీకు
Am I audible?
Yes, yes, ma'am.
Yeah, I have shared already to sir's WhatsApp. Please check it.
Okay, okay. 2 minutes.
Just check now. Is it visible? Because
So it is showing downloads only.
hello?
It is showing downloads only, ma'am.
అవునండి. బాగానే ఉంది. ఫస్ట్ ఏంటంటే మీ ఫీడ్బ్యాక్ గురించి ఫోన్ కాల్స్ పొద్దున ఒక 10, మధ్యాహ్నం ఒకటి, సాయంత్రం ఒకటి. నేను మొన్న కూడా చూసుకోవాలి. మరి ఒకసారి చేస్తే పర్లేదు, రెండుసార్లు చేస్తే పర్లేదు. 10 సార్లు ఎలాగైంది? కరెక్ట్‌గా మీరు బిజీగా ఉన్నప్పుడు
are you
బిజీగా ఉంటాను. మీరు నాకు ఫోన్ చేసి సర్వీస్ ఎలా
Is it visible, ma'am?
Can I start?
Yeah. Is the PowerPoint visible?
Yes, yes.
So can any participants can say, is the PowerPoint visible?
Yes, sir, it is visible.
Okay, ma'am. Okay, madam. You can start.
I'm going to give us a little bit of info. Ending topic from last 2 decades, but still are working on it. Will help you to just maintain your spirits in this as FDP. So they already introduced me. This is the topic I'm going to. Trends in metabolomics, novel analytical techniques. I can't move the slides. Some of you has to do it because I'm not the host.
Sir, can you please go the slides? Next slide. Yeah.
Yeah, this is the.
Your voice is breaking, madam.
So it is talking about metabolites. So it is the youngest of the omics triology. So it's omics in scientific fields, especially in biology. Here, triology means we are going to talk about genomics,
Madam, your voice is breaking.
Of the entire metabolome. It's nothing but the metabolomics of the biological samples. It's nothing but entire metabolome of a biological system and has positioned itself as an indispensable methodology, this particular metabolomic level. So
Hello, madam.
chemistry expert or pharmacology Hello, Bhaskar sir. Am I audible?
Now you are audible, madam. Madam.
Slide is also first slide.
Your voice is breaking, madam. I think there is a network issue.
Hello, shall I continue?
Madam, continue, madam. Continue, madam.
So it is sorry for the 3 times.
Madam, please continue.
So this is the multidisciplinary research, and it can provide unprecedented in-depth explanation and insights of the mechanisms responsible for various physiological conditions given in the innovative developments in analytical technologies, especially by adjoining artificial intelligence and machine learning. These are the trending terms in the computer sciences now. So, hello. వినిపించట్లేదా? నేను మ్యూట్. ఎందుకని? అంటే మేబీ హోస్ట్ చేస్తేనే వినిపిస్తుందేమో సార్.
No, ma'am. It is audible, ma'am. It is audible.
ఇట్స్ ఆల్.
Suman sir, is it audible?
Audible.
రెస్పాండ్ కూడా అవ్వట్లేదు సార్ అడుగుతుంటే. ఐఎమ్ ఫేసింగ్ లిటిల్ ప్రాబ్లమ్ హియర్. ఐ డోంట్ అండర్స్టాండ్ వై.
Just a minute, madam. Just a minute, I will call you.
It's audible to me, madam. It's
ఒక్క నిమిషం ఆగండి.
సార్.
వాయిస్ వినపడలేదు.
నాకు వినపడుతుంది.
మీకు వినపడుతుందండి?
నాకు వినపడుతుంది.
ఓకే, కంటిన్యూ చేసేయమన్నా. అందరికి వినపడుతుంది కదండి?
It is audible, sir.
వాళ్ళు కూడా చెప్తున్నారు, పార్టిసిపెంట్స్ కూడా వినపడుతుందని.
ఓకే ఓకే రైట్.
Okay.
So this is about
Okay,
the basic introduction, because it will be really, it's a very bad thing that the listeners, so this interruption is not good for. Hello. Okay, right, thank you. Right, so this is about the basic introduction. So here we have seen what is metabolomics, qualitative and quantitative investigation of metabolites in the biological system at cellular level, and multidisciplinary. It is multidisciplinary research. Another important thing is we need the expertise of several field people. As a team only we can work on it. And the second thing is advanced same way. Next slide, please. So coming to era of metabolomics is identification and quantification of as many metabolites as possible in a biological system. So it is a qualitative and quantitative and dynamic study also. Like molecular weight point of view, metabolite of less than 1500 Daltons only we can assess qualitatively, quantitatively by using metabolomic studies. That to present in organisms, tissues or cells at a specific moment and under a particular environmental condition. So less than 1500 Dalton is the molecular weight. And the scale, the recent recent research paper I have seen about the scaling of and an estimate assessing their levoisomer or dextroisomer. If metabolite, there is every chance that metabolite is specific, stereospecific. In that case also we can assess, and highly diverse physicochemical properties. Next slide. Yeah. So now in order to generate because we are in healthcare sector. So just we'll have some disease. It has several applications in health and disease, especially precision and personalized medicine. So now you all know that why the single medicine is not working same in all individuals. Even Indian medicinal system, metabolic system will respond to the paracetamol or any other disease-specific drug in a different manner than others. So any two persons are not same with respect to their metabolic profile to a single drug. Based on this phenomena, personalized medicine can take the advantage of this metabolomics, especially single cell epidemiological population studies, metabolic phenotyping and metabolome wide association studies, precision metabolomics. So in European countries and in advanced research countries like USA also, the precision metabolomics are taking a leap. So in combination with integrative omics, as I mentioned in your first slide, omics means biological studies, genomics, proteomics. Disease associated. A word like health. Small molecules, small metabolites can analytical chemistry. LCMS, the integrated analytical tools like LCMS-MS, GCMS-MS, and live single-cell mass spectrometry, imaging mass spectral analysis of human breast cancer samples at single-cell level also revealed. So I'm going to show some case studies also at the end of this study. It is possible to assess at single cell level also. Next slide, please. Coming to main approaches of metabolomics, the main strategy, targeted strategy and untargeted strategy. So untargeted strategy is the commonly used metabolomics strategy. Coming to targeted strategy, it is hypothesis based and quantification occurs absolutely. It's an absolute quantification strategy. Small number of metabolites can be assessed. MS correlated to reference standards generally. Limited applications. This is the problem with targeted strategy. Coming to untargeted strategy, which is commonly used and very renowned strategy of metabolomics, which is further classified into fingerprinting strategy and profiling. The inherent meaning in this strategy is untargeted strategy can be applicable in the field of fingerprinting and profiling. Means it is metabolic profiling. You can understand the word line. And it is exploratory and generates a hypothesis. it is more exploratory. With or without identification and quantification, we can go with not only quantification, even identification is also possible. That's why I can coin this word as relative. And large number of data sets can be assessed, unlike targeted strategy. It is MSMS correlated to databases, or even libraries can be used. Lot of existing libraries we can employ in the untargeted strategy. It has wide applications when compared to targeted strategy of metabolomics. Next slide. So coming to analytical techniques employed in this, metabolites represent a diverse group of low molecular weight structures. We all know that what is metabolism, biotransformation, and what are metabolites, all drug metabolites, and what is the correlation between the biomolecules in the physiological system and metabolites, what is the role of liver and cytochrome P450 enzymes. All these things we have studied in theory and practically also in several research groups, in several research points we have worked on. But here what we need to understand here is what kind of correlation is existing between metabolomics and existing analytical techniques. So before that, what are metabolites? As we know all, a diverse group of low molecular weight structures, including lipids, amino acids, peptides, nucleic acids, organic acids, vitamins, thiols, carbohydrates, which makes global analysis a difficult challenge, because if the metabolite is of one class, means it's very clear and any researcher can go with clarity. But here the metabolite single drug can be divided into, simplified into several metabolites. One metabolite is maybe an amino acid, another metabolite is a lipid, and one more metabolite is an organic acid or something like. So this is the reason for complexity of metabolic studies. And the recent rapid development of a range of analytical platforms, including like GC, HPLC, UPLS, and all these, we all know about all these things. Mass spectroscopy, NMR spectroscopy, but NMR and LCMS, these two are very important keywords in the metabolomic study. And the more important aspect here, the most important aspect here is integrated analytical tools that I am going to give emphasis on. So these are the different analytical techniques could enable the separation, identification, and all. And owing to the complexity of the metabolome and the diverse properties of metabolites, no single analytical platform can be employed here to detect or quantify. So the beauty of analytical techniques is integration is possible. So even based on the type of research required, based on the metabolite study required, you can integrate, you can customize the instruments. That much advanced technology is available now. So especially this metabolomics is concerned, no single analytical platform can be employed or applied to detect all the metabolites in a biological sample. So the combined use of modern instrumental analytical approaches has unraveled the ideal outcomes in the metabolomics and is beneficial to increase the coverage of detected metabolites that cannot be achieved by single analysis. For example, in NMR, the beauty of NMR is different. And the sensitization of LCMS is different. So by clubbing these things, and even the dimensions also has changed now, 4D, 5D, up to 5D they are going. So integrated platforms have been frequently used to provide sensitive and reliable detection of thousands of metabolites in a biofluid sample. Continued development of these analytical platforms will accelerate widespread use of integration of metabolomics into a systems biology. So systems biology means here we are talking about human body. So if you ingest any like xenobiotic, whether it is food or drug, so how it is metabolizing, how many metabolites are circulating that compartments, what is the role of each metabolite, what is the stay of each metabolite, and what is the effect of this metabolite on different organs of the body. In order to analyze this, metabolomics is very important. If they understand the secret behind the metabolomic studies, definitely one can explore the reason or the root cause of many lifestyle diseases nowadays, because that's why all premier institutions are working on these metabolomics. Next slide. So these are the list of, like, this is the list of integrated analytical platforms. So up to my knowledge, I have listed here NMR, UPLC, you all know UPLC. UPLC coupled with quadrupole time of flight mass spectral analysis. Even MALDI, you know, different around, as per my knowledge, 14 to 16 ionization techniques are there in mass spectral analysis. So each so as I mentioned in the previous slide also, depending upon the type of metabolite you are studying, you have to integrate the different techniques like spectroscopy and chromatography integration here. So MALDI, FTICR and MS. And HPLC with UV visible absorbance, photodiode array or electrochemical detectors. Detector you can change depending upon the study. FTICR and MS, GCMS, LCMS, even two-dimensional. This is very interesting. It's even, it has grabbed my attention also. Two-dimensional GCMS. And an integrated ionization approach of electron spray ionization, ESI, atmospheric pressure chemical ionization, APCI, and atmospheric pressure photoionization. These all we know. These are the different ionization techniques of mass. They combined with rapid resolution, that is LCMS. And CEMS is another technique, and two-dimensional GC with time of flight mass spectroscopy is another important technique here. And even MALDI, FTICR and MS, this is also important. So these are all the integrated analytical platforms and can be employed in order to study metabolomics. And coming to analysis flow, you can see the chromatographic flow of metabolomic study. So if you insert capillary electrophoresis, CE means you all know, no? Capillary electrophoresis. So untargeted metabolomics, now I am focusing on not on targeted ones. Coming to targeted metabolomics, this is the sample, means sampling, and then data acquisition, whether if you employ NMR tool or LCMS tool or GCMS tool or any integrated interface. So spectral analysis. And then it is next point is spectral processing. This is very important. Like spectral processing, many of us, we know biological samples requirement and data acquisition part, but many people, they won't be expertise in spectral processing, like how to identify the peaks, peak detections, peak alignments, normalizations, and baseline corrections, all these things. If consistent approach is there, only we can do it. So this is the matrix, and then it is connected to data analysis and metabolite identification simultaneously. In data analysis, univariant, you know, data analysis, how good it is and how important and how vital it is. Because any analytical person, researcher having analytical brain, they need to apply, the real application comes here. Univariant analysis, multivariant analysis, supervised multivariant, and multi-assay methods. How to, the data, obtaining data is the instrumental work. But after getting the data, what is the role of analyst here? What is the role of a researcher here? This is very important. This is the complexity of even metabolomics. Data analysis is various methods are there, and metabolite identification from the spectral database and data sets features. So then here the structural elucidation, what kind of structures are elucidated from this data, like what kind of different metabolites can be identified. And finally, you have to correlate the identified data technically with the biological interpretations, because suppose you are taking the biosample from the lungs, like lung cancer patient, or the rat used with lung cancer you treated, and then you have extracted the biological sample. Then that one you have been introduced to this metabolomic study. Then what is the penultimate goal is data analysis and metabolite identification. What is the ultimate goal of this metabolomics? You need to correlate this data to the biological interpretation, nothing but you are expecting some parameters to be identified and some deviations, some normalities. So whether you have reached those expectations or not, are your study significant, probability of significance, correlations, and all these things you have to correlate. This is also very, very important. So many, like I'm going to give the tools, like apart from analytical tools, several softwares available to analyze the data also. This is about the workflow. Next slide, please. So this is the list of tools available for metabolomic spectral processing and data analysis. So just look at the first one, like metaboloanalyst 2 web type. It is web. So because of producers, the MATLAB is there, R programming, what kind of programming they are using in that, and target. So what kind of analytical spectral analysis it will integrated with mass and NMR. So features. So these features in the next slide, I'll tell what is this 127, 123, 125 and all. And website, the link also it is given here. You can take a look on, and reference. So who is the researcher and what year of research also you can see. If you see carefully, all are after 2000 only. All are after 2000 only. Before 2000, there is no word of metabolomics. After 2000 also, it has taken the paradigm shift, especially after 2010. If you see carefully, last 5 years also, enormous. Lot of papers have been published on this from the premier institutions, including IIT, snipers and all. So this is the list. You can have a glance on what are the different tools used to analyze this big data. I can call it as big data analysis. And next slide, please. The continuation slide. Next slide. Yeah, this is the continuation. Batman camera and METPA and Vanted. All these are Pentomics. Before slide. Yeah. So R programming, web applications. So this is the type, and NMR, LCMS is the integrated system. And these are the links and the researcher and the year of research. At footnote, you can see the table, the particular table. What is that? 1, 2, 3 denotes is 1 means it's a spectral peak alignment. 2 means peak detection, metabolite identification. Nothing but the particular software tool can able to handle these many things. 1 to 7 means all the 7 parameters it can. Nothing but including spectral alignment, peak alignment, peak detection, metabolite identification, data analysis, data interpretation, even pathway analysis also. Glucose 6 phosphatase pathway is there, for example. So that pathway detection also in this pathway, which is the interruption. What is the interruption? And even 2D analysis, 7 is pathway visualization, and 6 is pathway analysis, and 5th is data analysis, 4th is metabolite identification, 3rd is peak detection, and 2nd is spectral and peak alignment. The first one is pre-processing tool. It's a spectral pre-processing tool. So these are the 8 parameters actually any researcher needs to go for the big data analysis. So here the list of tools, and each tool, its capacity, how many out of these 8 it can handle with the information. Next slide, please. So coming to the recent advances in targeted and untargeted metabolomics, recently, like in 2022, one research paper I have seen that why to suffer from like targeted is limited applications, untargeted is large data sets are there, and wide applications and exploratory. So some researchers, they thought of leveraging these two, like by leveraging the advantages and disadvantages of metabolomics analysis, researchers have begun to develop strategies and combine multiple analytical approaches to mitigate the pitfalls of both the techniques. What are the pitfalls of the targeted metabolomics? Limited applications are there here, and that too only hypothesis based. That too only it is confined to quantification. It's absolute quantification. Sometimes absolute quantification is not possible, right? So coming to untargeted metabolomics, what is the pitfall here? It's a large data sets, even though it is having lot of applications, it is relative, and large data sets are there. So by combining these two, so in order to mitigate these pitfalls, both the strategies can be leveraged. For example, in one study examining the metabolome involved in the pathogenesis of hyperuricemia, you know the condition of gout, hyperuricemia, utilized untargeted metabolomics to screen novel candidate biomarkers. Targeted metabolomics was then used to verify the identified biomarkers. See the beauty of leveraging here. So by using untargeted metabolomics, they have come to conclusion that they identified the biomarkers, like they have seen the biomarkers, they might play a role in this hyperuricemia. But after that step, in the second step, targeted metabolomics can be employed in order to identify what are those biomarkers. Absolutely, absolute quantification is possible. So the combination of these methods has allowed for novel insights into pathogenesis of many other diseases, not only uricemia and all, including cardiovascular, neurodegenerative like Alzheimer's, diabetes. It's a big problem nowadays, and cancer, of course, it has become so common nowadays. These all are lifestyle diseases and Schedule J diseases, non-curable. So these metabolomics may, like, it can show the limelight on this research. Scientists have also used semi-targeted analysis involving hundreds of metabolites, but often without hypothesis. This is also interesting aspect. This approach has also provided considerable insight into physiology and disease. For instance, semi-targeted metabolomics played a pivotal role in pinpointing essential metabolites linked to future risk of, for example, pancreatic cancer is there. Like, I can say it is preventive. So if they could able to, any researcher could able to identify the key metabolite which is the responsible for causing pancreatic cancer in future. Suppose he or she is consuming kind of things or medicines or any xenobiotic, the metabolite evolved from the regular routine, it may cause future pancreatic cancer. Like if any point has been revealed by the can be protected from the pancreatic cancer. This kind of approach is possible from semi-targeted analysis. Others have integrated metabolomics with genome-wide association studies to establish genetic associations with fluctuating metabolite levels to further understand causal mechanisms underlying physiology and disease. So if we see carefully, for many, still in pharmacology or in many research papers, you can see the mechanism is unknown. Mechanism is unknown. It is because of unknown mechanism. So what does it mean? Because of unknown mechanism means how can we find the solution? So the present advanced metabolomics and metabolomic studies may pave way to crack these unknown mechanisms. Next slide. So here, just to grab your attention, some snippets like case studies. Just to create some interest in you, I have collected some case studies, but because of time confinement, now 12 o'clock I have another meeting. So I want to confine myself to only list of case studies, snippets I call it as. So metabolomic based biomarker discovery for non-invasive lung cancer screening, a case study. I have given the link also here. And research outcome means they have identified 6 metabolites discriminated between non-small cell and small cell lung cancers using artificial neural networks. See the beauty of integration between pharmaceutical sciences and information technology. So we should not, like earlier days, so I will confine to my own chemistry, I'll confine to my own analytical chemistry. This is the attitude of most of the researchers. But the present scenario is, from the decade, we have to work as a team. So this research itself is showing the need of working as a team, multidisciplinary research. That's what our national education policy is also asking us to align with. So we have to combine with the technically sound person, analytical person, chemistry person, and one biologist, biological researcher, like IICT scientist or etc. So then you can come out with a good outcome on this research. Single researcher cannot evolve, yield any good outcome out of metabolomics. And the second case study, if you see comparison of metabolomics approaches for evaluating the variability of complex botanical preparations, green tea as a case study. It is interesting aspect because I have seen the green fields, and also we have been using, most of us, green tea. Lot of varieties are there, and so lot of debate is there. Green tea, antioxidant. The market has elevated like anything by using these technical words, sales promotion techniques. But what is happening in our body exactly if you have green tea? What kind of metabolites are forming? How they are affecting our like free radical generations, or are they scavenging the free radicals? That's why we are calling them as antioxidants. What is happening? So one of them, they studied. This is the link, and the obtained results demonstrated the utility of metabolomics employing UPLC mass data for evaluating similarities and differences between complex botanical products. So different green teas are there, how they are showing the impact, what is the difference inside the body, if they're kept in the chiral atmosphere like human body, how they are differing. And the third one is fusion. That's what I am talking about, fusion of metabolomics and proteomics data for biomarkers discovery. So what is the ultimate goal of metabolomic study? Discovery of biomarkers. If biomarker is not available, no one can do anything. Biomarker identification, quantification, structural elucidation is very, very important. So fusion of metabolomics and proteomics data for biomarker discovery, case study on the experimental autoimmune encephalomyelitis. This is another case study I found. Here the research outcome is fusion of proteomics and metabolomics data is possible. The main issues of high dimensionality and missing values are overcome. The outcome leads to higher accuracy in prediction and more exhaustive description of the disease profile. The biological interpretation of the involved variables validates our fusion approach. They finally concluded that, so the fusion is successful. We can go for this fusion by combining the omics triology, or four eyes, we can call it as. Next slide. So these are some opportunities and challenges. So I thought to little bit elaborate this, but I have got 1 hour time, and that too, some of the time went on technical glitches. So we have come to a conclusion. The final thing is opportunities and challenges. Here just I want to give some emphasis on NMR platform. If you take NMR spectroscopy, what is the advantage? What is the disadvantage? What kind of metabolite can be detected? You all know that NMR is non-destructive to the sample, quantitative, simple preparation, and very reproducible results we can get. Disadvantage is less sensitive than other techniques, but can detect millimolar quantities also. Even cryophobes requires large sample volumes. Sugars, amines, volatile liquids, large metabolites, these are the metabolites we can detect. Coming to UHPLC, MS, you can see short separation time, high resolution, high mass accuracy, etc. And even wider range metabolites, you can use HPLC mass than GCMS. It has advantage over GCMS. The disadvantage is destructive to the sample. Its reproducibility is relatively different and difficult also. And coming to the various metabolites, medium to high lipophilicity compounds like low not, medium to high lipophilic compounds metabolites can be detected, nucleotides and nucleosides, and lysophosphatidyl-cholines, acyl carnitines, acyl glycosins. Like they have listed out few things based on their exhaustive review. And polar metabolites, even this is applicable for polar metabolites like amino and non-polar metabolites, fatty acids and steroids. Next slide, please. The continuation GCMS, one more is reproducible, retention times, comprehensive databases for metabolite identification. And here the disadvantage is extensive sample preparation is required, and derivatization is, we all know that the GC and GCMS always demands derivatization. We know the reason also. Possible variation introduced due to sample preparation. and what kind of metabolites we can deal with: GCMS, steroids, eicosanoids, carbohydrates, esters, phosphorylated metabolites, cholesterol, volatile compounds, etc. Next slide. So this is about, so the final conclusion of metabolomic study and the challenges, the other challenges also there. So I have mentioned already: data sharing, meta-analysis, acquisition, extraction of data, quantification, annotations. So these all are, it's a cyclic process. We need to connect all these things in order to face the big data challenge, in order to get yield out of it, like pathways, data mining, all these things. Optimization is also very important here. So with this, I want to conclude. Finally, my remarks here is, every pharma researchers need to know about this field, because it is the trending field in the, which is integrated with analytical technology. Don't tell that I am pharmacology, madam, I don't want to know about this, what is the use? So it's ruled out. This phenomena has ruled out in the present situation. So every researcher need to know about at least what is going on in our surroundings. If we cannot do, the facilities may not permit us, but you can collaborate with the researchers. You at least you should have that zeal to know about the things theoretically first. Read the research papers and read the research reviews, recent reviews. So try to get some knowledge so that the interest can be generated. I hope my presentation has given a little information about metabolomics. And thank you very much once again to Dr. Bhaskar Raju Garu for giving this opportunity, and management of Sri Vasavi Institute of Pharmaceutical Sciences for conducting such a need of our FDP. Thank you, one and all.
Thank you, ma'am. It is a wonderful session.
If you have any queries, you can ask for 1 or 2 minutes.
Ma'am?
Yeah.
Can you describe about NEP 2020? Something more.
So it needs another FDP, sir. To describe NEP 2020, it needs, like, as you asked, just with my experience, because I have been exposed right from the pandemic time. That time we got little time to listen to all renowned persons of pharma field. What is NEP and all? It has been introduced first time when Suresh sir was as like PCA president. That time I have been listening, and recently also so many UGC this TOT training to trainers program and all we have attended, professor of practice and all we are into. So as per my knowledge, that's what I have linked this metabolomics also, multidisciplinary research. This is the ultimate goal of NEP. One of the goal I can say. So we cannot deny the role of
Right.
BCom computer sciences graduate also. Every knowledge of every domain we need. We have to team up and we need to come out with a product which is at the doorstep of the commuter's interest. We have to take into account, sir. Community problem identification is not done only, as guide said, you do the research. This won't yield any outcome. You have to identify the problem in and around us in the community, and what can be the role of the pharmacist in that, as a researcher, academician, a community pharmacist, whatever may be the role. By teaming up with the different field experts, we can align with the NEP standards. Only I'm talking about research, other point of view, because it is another big aspect actually. We cannot talk here fully. Any other questions?
Thank you.
Any other questions from our participants? Hello? Hello? Hello?
No, sir, no one is speaking.
So thank you so much, madam.
Messaging thank you. They are messaging thank you means it's better to say goodbye. Like.
Thank you, madam. Thank you so much for your wonderful presentation. So regarding analysis of metabolomics, and You have given various analytical techniques regarding this metabolomics and various softwares also. And you have given your valuable insights regarding this new educational policy also. So thank you so much, madam. Your presentation will be very, very useful to our participants. And thank you for encouraging us by sparing your valuable time, madam. So thank you so much on behalf of our management.
Yeah, you are most welcome, sir. Thank you. Thank you. Outside, students are waiting. One more program is there now. Thank you.
Okay, madam. Thank you. Thank you so much. Thank you. Thank you, madam. We will leave.
వెళ్ళిపోయాడా? So dear participants, we will share the feedback link within 5 minutes.
Okay, sir. Sure. Please, sir.
So we'll ending the meeting, sir.
Okay, sir.